An offshore rig was working in western coast of India in one of the wells of an unmanned platform. Next set of operations planned were BOP stack testing and subsequent pulling out of tubing assembly, along with packer and hanger from the well. The drill crew had to change the elevator for latching the 3.5-inch tubing landing joint. During hookup of the elevator, one operator was on the air tugger and the driller, along with other flowmen, were handling the elevator bales. In the process, the rope slipped from the hand of the driller, leading the bale to swing and hit the upper tip of his left middle finger, which was caught between the bale and elevator. The job was immediately and safely stopped, and the injured person, driller, was reported immediately to the rig doctor. Rig doctor examined the patient and gave treatment accordingly and advised immediate evacuation. So let's understand what were immediate and root causes of this incident. And what do we learn from this? No stop work authority was used, nor there was safety intervention by the floor man, who was junior to driller, to stop when it is not safe, nor correct tools are used for the job. Lack of risk assessment led the driller to use a rope instead of a hands-free tool to guide the elevator into the bales. And in the process of moving the bales with rope, the rope slipped from the hands of the driller and the incident occurred, causing deep laceration of left middle finger of the driller. There were only 2 persons performing the activity, and one of the persons was the supervisor himself. Instead of supervising, he was involved directly in the activity. As a result, nobody could raise the alert about the hazards involved in the operation. The operator at the time of moving the elevator was not wearing impact-resistant gloves, and as a result, the accident caused the operator to suffer a serious injury on the left middle finger. There was shortage of manpower due to part of rig crew being engaged for BOP nippling up job. This led to inadequate manpower at rig floor. Following are the lessons to be learned from this incident. Safety intervention by team or stop work authority must be taken whenever there is any unsafe condition present or unsafe act being done. Crew must contribute towards providing safety interventions or calling out stop work authority. It is extremely important to do risk assessment before the start of any job. Risk assessment involves identifying all the risks associated with the job and to develop and implement the mitigation plan for the same. The details of the identified risk, mitigation plan and SOP for the job need to be discussed with all personnel carrying out the job before starting any job. Before commencement of any job, it is very important to ensure that all personnel needed for the job are available. The supervisor must supervise the job being carried out and make sure that all safe operating procedures are being followed. The supervisor should not get involved directly in any activity. The driller at the time of operation was not using impact-resistant gloves, and as a result, the injury on the finger was substantial. Use of impact-resistant gloves would have resulted in a much less severe injury. Suitable PPE, as per nature of operations, should be used. The person at the time of operation was not using elevator hook guide and was using his hands instead to put elevator onto the bales. Because of not using the right tool for the job, the rope slipped causing injury to the operator. For such operations, crew is advised to use elevator hook guide without fail. Also, the crew to be provided refresher training on using the hands-free tool. During the operation, the placement of the hand of the operator on the bales was risky. And so, when the incident happened, the fingers came in between the bales and elevator. Dealing with equipment should happen on their designated hand placement pointers. We should be vigilant and alert to make our working environment safe and incident-free at all times.